My name is Neville Solomon and I'm the head of Department of Pediatric Cardiac Surgery at Apollo Children's Hospital, Chennai. We are one of the premier pediatric cardiac units in the country, doing all variety of intervention and pediatric cardiac surgeries on newborn babies up to the age of 16 years and adult congenitals. Our reputation is so huge that we get a lot of international patients, and by and large most patients coming from abroad for pediatric heart surgery to India are complex cases which cannot be handled there. We have had the pleasure of treating Abdul Rheman, a young boy. This is the mom here with me. So this boy had a very complex condition called double outlet right ventricle with a ventricular septal defect, a hole in the heart that was very low down and the pipes all arising from the wrong side. And he had a first surgery at Apollo, at one of the outside hospitals about a year back, where it was a PA band and the pulmonary artery pressures were very high. So this case was seen by us and we felt that the pulmonary artery pressures were a little high and we wanted to give the best for the child. We wanted to do a perfect surgery so the boy does not have to come back to India again for another surgery and is cured for life. One of the risk factors was the pathophysiology, that is the high pressures in the lungs. The second is the anatomy, the actual structure of the heart, where we had to, with great difficulty, make the left ventricle pump blood to the correct pipe, which is on the wrong side. And so we did a lot of planning. We are blessed with a big team here of good cardiologists. We cooperate with Apollo Bombay. Dr. Bhushan was our pediatric cardiologist who initially diagnosed this patient. And we have interventional cardiologists here as well, and my partner Dr. Janil, and a big team of dedicated pediatric cardiac anesthetists, perfusionists and intensivists. So we had a multidisciplinary meeting on this patient and decided the best surgery would be to take down the PA band and to direct the left ventricle into the aorta through a complex procedure and hopefully avoid a conduit, that is an artificial valve, which means that baby has to come back every 5 to 10 years for other operations. So we explained the high risk and then we went ahead with surgery, and the surgery was very nicely executed. We could direct the left ventricle to the pipe which was on the wrong side of the heart, and we could avoid an artificial valve. We used the patient's own pathways. So, and then the child was a bit sick for 2-3 days in our intensive care unit, and this was managed by our team, and we were able to get the child through, and the baby, by the grace of God, is ready to fly back in a few days back to Nigeria. And it has been a pleasure managing this baby. And if the mother would like to add some words.
I really appreciate the team of cardio in Apollo Chennai Hospital. They've done well. Starting from the nurses down to the surgeons, they've really taken care of Abdul Rheman. Abdul Rheman have gone through a lot in his life, starting from 6 months when we discovered that he has a heart issue. They've been trying to do everything, and they've done well to make sure that his health issue is, if not 100% done, but at least 98% corrected. We really appreciate it. And I hope when I get to Nigeria, I'll also go there to tell people how well they've done well, starting from the entrance of the hospital, the receptionist, down to the nurses, to the security, and